Welcome to Perspectives Matter, a McQuestion program, where for over 35 years we've been talking about things that matter with people who care on topics that impact our daily lives. Production of the program is made possible by donations from our viewers, grants, organizations, and individual supporters.
So here's a surprising fact. Dallas ranks as the 18th wealthiest city in the world, but has the 6th highest number of people in the nation facing food insecurity. Think of this. That's 1.2 million people, or 1 in 7 individuals, who lack basic access to sufficient food to live productive lives. Now here's another stat that should concern, if not embarrass us. Texas now leads the country in hunger. How can it be that 44 million people in the United States are unsure of where their next meal will come from, here in one of the richest countries in the world? I'm Jim Falk, and thank you so much for joining this program, where we will explore the root causes of food insecurity, discover who is affected, and learn what steps are and can be taken to reduce, if not eliminate it, from our society. Let's introduce our guests. Subject matter experts on food insecurity and hunger, who each in their unique way, individually and through their respective organizations, are responding to what many consider an avoidable crisis. Trisha Cunningham, she is the president and CEO of the North Texas Food Bank. She joined the food bank in July 2017, coming from Texas Instruments, where she served in several key senior positions in the company's communications area. Based in North Texas, let me welcome Matt Dufrene. He's a vice president at Texas Health Resources, where his responsibility is to improve the health of people in the communities in the areas served by Texas Health Resources. And he leads Fort Worth's Blue Zones Project, an initiative that I want to be sure that we talk about. Crystal Fitzsimmons is the interim president at FRAC, Food Research and Action Center, an organization that for more than 50 years has worked to end hunger through advocacy, innovative policy solutions. She has written and testified very frequently on the importance of school meals for all. Welcome to all of you. This is such an important topic to be talking about. So I mentioned these really surprising and staggering statistics, Tricia. Give us sort of a sense and the context and the trends. Who are these people?
Well, if you go back and you look before the pandemic, hunger was hidden. If you go back to the pandemic, everyone saw the long lines, and so hunger became exposed, and people realized we had a hunger problem. That hunger problem has always been there. It just never got the attention that it did because we had to serve differently. Now, after the pandemic, you mentioned the 44 million people in the U.S., based upon a 2022 study, that are food insecure. We had the biggest jump from 2021 to 2022 that we've had since 2008 in food insecurity.
And we have this graph here that shows
Absolutely. It shows the uptick there.
Yeah, I don't get the uptick.
Yeah, so if you think about during the pandemic, we had many individuals who were able to get their stimulus checks. They had the child tax credit. And so all these additional supports were around those families, and so they weren't food insecure. But now what we're seeing are the impact of inflation. And we're seeing prices that have gone up so much. You go to the grocery store now and you can see the impact of what is happening on our own. Imagine someone who's food insecure that doesn't have the resources and their paycheck didn't go up 30%, which is what average food cost, 20 to 30% is the average food cost increase over the last 3 years. And they're not able to purchase that. So what we're seeing now is a new level of food insecurity impacting middle-class families that have never needed access to charitable food assistance before.
And I think it was in some of the data that you sent me that for the typical family, inflation has had such a dramatic impact, as we know, but not just food, but housing and all medical-related expenses. So the typical family has seen their costs going up close to $1,000 a month.
That's right. If you look in Texas, there was a joint congressional economic report, and they took the same items in 2021 and compared them to 2023. It was an increase of $1,040 per month that families are having. And food was an increase of $141 per month. And for those that were the lowest income, 70% of their income just goes for rent, the housing, transportation, and food, the three basics. So that leaves only 30% for things like utilities and childcare and medicine, other essential items that families need, and they just are not able to make it now.
Now, I'm not sure who wants to answer this question, but I was a bit confused about the difference between hunger and food insecurity. Yeah. You want to take that one?
Sure. So first of all, echoing everything that Trisha said, I mean, clearly there's a lot of people that are facing issues with hunger. What we would say from a healthcare perspective is we also are very concerned about food that promotes well-being. So the definition, if you will, is consistent access and availability of and affordability, key definition there, to food that promotes well-being, that prevents disease, and in some cases treats disease. So yes to hunger, to food insecurity, but also thinking about making sure everyone has access to healthy food that keeps them out of Texas Health Hospitals, right, at the end of the day. So very much they're not exactly the same, but they're both really important issues for certainly all North Texans, but also especially for kids in North Texas. And I think that that's something we really are very cognizant of as well as families with especially small children.
And while we're talking about kids, this is when I need to bring in Crystal, because this is what you were really focused on. Tell us, I mean, we all know that how important the formative years are, but what is happening with children now in the United States?
Yeah, well, so we have millions of kids who are living in food insecure households. And one of the most amazing things that we can do is make sure that kids have access to healthy meals at school, so school breakfast and school lunch. And going back to the earlier comments about how we lost so many things that were available during the pandemic, across the nation, schools were able to offer free meals to all their students. And it had a huge impact in supporting families. Because if you think about it, if families can really rely on school breakfast and school lunch, for 180 school days a year, that's about the average, that really does reduce their household food costs, and it helps make it easier for them to break even.
So what is the status of some of these programs, especially, Crystal, again to you, about students having access to breakfast and lunch? And are the regulations the same across the United States, or is it decided by the federal government or by each state?
Yeah, so there are federal rules for how the school nutrition programs operate, and most schools have to provide meals for free for kids who are eligible, reduced price, or paid. There is an option to offer free meals to all students, and I'm happy to report that in Dallas and Fort Worth, schools are using that option to offer free meals to all their students. So we want to see that happening nationwide and across Texas, making sure that all kids everywhere are able to access the nutritious meals they need at school.
And why is it so important for all children to be able to receive free meals at the same school? And that some of the conditions that affect children if they see, oh, John is getting a free meal, but I'm bringing my lunchbox.
Yeah, well, so there can be a lot of stigma in the school cafeteria. Kids are very aware of what's going on. We see kids opt out of free school meals as they get older and become more aware of the stigma. So by the time kids get to middle and high school, they're opting out of the program. So by offering meals to all kids at no charge, that really does allow all kids, including the kids who really, really need free school meals, to participate. So it eliminates the stigma, it reduces administrative work for the schools, and you know that even if a child forgets to bring their lunch into school that day, they will be able to access lunch, they'll be able to return from recess well-nourished and ready to learn.
So this morning driving into the studio, I went by our local grocery store, and I like to have a nutritious meal, so I picked up this apple. What do you think it cost?
A lot.
A lot.
More than it used to.
More than it used to. This apple costs $1.
Yes.
And so when you look at the average family and you're trying to decide, am I going to buy an apple or am I going to buy some processed food, which is a lot cheaper, or stop at your local, I'll say it, McDonald's and get a cheaper meal? I want you to talk, Matt, about how important nutrition is, and don't just look at how many calories are in a bag of chips.
So I think there's some pretty staggering facts about nutrition, and especially about impact on health and well-being. The USDA says this, 85%, so just let that sink in for a moment, 85% of the health spend in the United States today is related to diet-related chronic disease management. So it's not the only factor, right? But think about obesity, think about diabetes, think about heart disease. That's significant.
And perhaps cancer that we don't know about.
That's right. There certainly are other diet-related issues as well. So 85% of that spend is related in some way to diet, right? There's other issues as well. There was also a recent study, as a matter of fact, a study that was released just this last week in the Lancet. And it said this.
What's the Lancet?
Lancet is a journal, a medical journal. We'll make sure that
like the Journal of New England Medicine, but
that's right. So the Lancet article said this. It said that almost 75% of adults in the U.S. are now overweight or obese. So again, think about that in relation to 85% of the spend. But Texas has a dubious honor. In Texas, we have the highest percentage of adolescent males who are overweight or obese. So adolescent males, 15 to 24.
Texas always has to be number one.
Always has to be number one, right? But over 52% of adolescent males are now overweight, obese. Those are significant challenges, not just now, but in the long term from a healthcare perspective as well.
So another thing that really surprised me is that, and we have so many military bases in Texas, that, let me find that statistic, a 2023 study reported that food insecurity rates on military installations goes from 15 to 33%. Mm-hmm. I mean, that's a staggering statistic.
It is a staggering statistic. And, and we were talking about being number one. Texas is also number one in the nation now as far as the state that is the most food insecure. And you see military families, they just are not making a livable wage in order to be able to afford what's happening here in the economy. And, 40% of those right here in Texas are children, too. Mm-hmm. And so imagine the families of those military and the children that are there and what the pay scale that they're living on is not able to provide for those family needs overall. And so, and it's not just military, it's everyone in our community overall. Here in the area, just at the area that the North Texas Food Bank serves, we have almost 800,000 people. That's the fourth highest food insecure area served by a Feeding America food bank in the nation. And we see so much here, growth and so much prosperity and so much things, but people forget that sometimes when you have all those additional things that are raising the cost, that you also have people that can't afford those increases in cost as well.
Do you see a sharp difference between, say, people who live in rural areas and urban areas? Crystal, how does that, as far as providing subsidies?
Yeah, so people don't always think of this, but families in rural areas actually have higher rates of food insecurity than they do in metro areas. And so, and the stigma can even be more pronounced in rural areas where everybody knows their neighbors and may not want to participate in free meals, may not want to apply for SNAP, may not want to be seen at the food bank. And so the more we can do to reduce stigma and make sure that people are easily able to access the food they need and access the programs that are available to them, the more it will help in rural areas too.
I know, Matt, that this is only part of the work that you do, but I am fascinated and I want our viewers to know about the Blue Zones Project.
Sure. So Blue Zones is a community-wide health and well-being initiative, and it's based on research that was done about the longest-lived people in the world, so across the entire world. Genetics isn't the common denominator necessarily when it comes to health and well-being and longevity. Probably about 25% or 30% of our longevity is determined by genetics. That's the bad news. The good news is that probably 75 to 80% of our health and well-being, our longevity is actually determined by behaviors, by environment, by the social norms, right? And when you're talking about food and nutrition, that's really what you're talking about is the social norms, the cultural, the environment. So whether it be access to healthy food, et cetera. So Blue Zones was an initiative that Fort Worth undertook going way, almost 11 years ago now. And here's the one thing that I would want to make sure that your viewers know. I am convinced that you can tackle really big community issues because of the success we saw with Blue Zones Project. When we began Blue Zones Project, Fort Worth was near the bottom of large metro areas in terms of our health and well-being. 185th out of 190, so significant. At the conclusion of and then subsequent to that of our initial Blue Zones work, our well-being score had risen to a tie for 31st place. Now, a lot of things were a part of that, but again, I know communities can tackle big issues. Here's the one thing that I would say that still very much informs our worldview and specifically around food. One of the most important things from the Blue Zones is an environment shapes behavior. So for all of us, every single day, the activity that we do, the things that we eat, the environment, the social, cultural norms all around us very much influence, if not dictate, our behavior. And that's certainly what we find when we're talking about especially nutrition insecurity.
So what are some of the programs that you're offering?
So, of course, we partner with many of the food banks across North Texas, implementing healthy pantries, and it's significantly focused on access to produce. So from a health and well-being perspective, we certainly would want more people to eat produce. We also have a program that we implement in North Texas called Double Up Food Bucks. Now, the way that we implement that's a little bit different than some communities, but here's what's important for us. We want to really influence and incentivize people to eat more produce. And we know that there's a cost barrier. Yeah. So by implementing Double Up Food Bucks, we focus on doubling the value of SNAP benefits, specifically when people purchase produce. And so we do that now across North Texas in 15 locations. But it's focused and
so where does the money come to support this?
That's right. So to date, Texas Health has actually funded the lion's share of those doubling efforts. So over 100,000 transactions that we've doubled across North Texas today. But it takes a lot of community partners working together to really get down to the root causes and address this at the macro level.
So do all grocery stores offer this, or how does that work?
So if that would be a fantastic thing if we could. Obviously budget is one of the major factors in cost here. But we're now in a number of farmers markets and a number of grocery stores. And I do want to make sure that we address for the listeners.
So people show that they're eligible for SNAP benefits.
That's right. We have to think beyond just grocery stores being the only solution. Food banks, grocery stores, farmers markets. There's a whole host of real community-based initiatives that we have to think of. And it's the entire food ecosystem. We have to think about how we address this problem, not just from hunger, but also for nutrition security.
And that's good for everybody.
It's good for everybody.
So Trisha, you're involved with the Food RX initiative.
Absolutely.
Is that sort of a collaborative?
It is. That's one of our new
effort?
pilot programs. So if you look at how we try to address food insecurity, we have a very strategic approach of how we do that. We look at hunger at the zip code level, and then we have data from a Map the Meal Gap study that Feeding America does that we can have at the level of the zip code, and then we know whether the pantries in that area are providing the food that's needed for that area, and then also the additional services. And we did some pilots around this, and obviously health is one of the major areas that we know can be impacted by access to adequate food, in addition to education, attainment, and some of the things that we've talked about with children as well. But when we started piloting the Food RX program, we knew this was something that was very important to health outcomes. So we worked with some of the hospitals in the area. We tried to understand what are their barriers, what are their concerns, because they were starting to screen more for the social determinants of health. And they found that many of those patients that they were dismissed were food insecure. So how can we connect them with food pantries, give them the kind of counseling that they need on understanding the healthy food that they need for their condition that they were dismissed with, so that way they don't end up back in the hospital.
Are people receptive?
They are. They are. And, obviously some are going to be more receptive than others, but I can give you an example of going to a food pantry that is helping with this Food RX program. And I was shopping with one of the neighbors that was there, and she was saying that she needed to make some soup. And we were going through there, and I said, I make a taco soup with corn in it. And so I pulled some corn off. And she said, no, I'm diabetic. Said, and corn has starch in it, which will turn to sugar, so I actually don't eat a lot of corn. And I said, oh, really? I said, how did you find out? And she said, no, it was through the program here that they taught me the things that I should eat and shouldn't eat because of my medical condition. And those are the kind of programs that we need to help solve that. I mean, we provided more than 107 million meals out into our community that were healthy meals.
That's right.
We
That's
actually focus on
fantastic.
healthy. More than 90% of everything we distribute is healthy at the North Texas Food Bank, and 35% of that last year was fresh produce.
Crystal, when you're looking at school meals for all, are you also focusing on nutrition, and how do you ensure that our students, our children, are getting the best possible meals?
Absolutely. So when we talk about free school meals for all, we actually talk about healthy school meals for all. All of the school breakfasts and lunches have to meet nutrition standards. There's actually research that says that the meals that kids are eating at school are some of the healthiest meals that they're eating. But the cafeteria is really just an amazing place to introduce kids to new fruits and vegetables, whole grains, low-fat milk, all the healthy things that you want kids to be eating. And kids are developing their food preferences as they're growing up. So school meals is a really important strategy to support anti-hunger efforts, but also anti-obesity efforts as well.
You know, I can still remember those fish sticks when I was in elementary school on Friday. So I hope things have gotten better. You know, one of the things, too, that you talk about a lot is waste. And what is it? Something like 30% of global food supply is wasted. What are the reasons for that, Trisha? And are improvements being made?
Improvements are being made. And, you know, there's a lot of reasons why you have food waste. I mean, we all have food waste. Sometimes there's just spoilage. Sometimes ready to eat food that you're seeing at the restaurant or at a big buffet, you can't maintain that temperature for a long period of time where it's continued to be safe for those who might consume it. Every time we can, we try to pair those with organizations that do congregate meal programs so that they can try to make sure that they have that. But a lot of times it just takes extra effort. And unless we need a bottoms up and a tops down approach with all the retailers that deal in food and food manufacturers to say food should not go to waste. And I'm so proud of so many of our retail chains that have taken on that challenge from the top, and they're trying to reduce that food waste at the retail chain, and they're partnering in the community with food banks so that we can make sure anything that is not saleable, that's getting close to the end of life, that we can get it to those and get it out. We're also working with distribution centers. And distribution centers, they know how to manage their inventory, but if they see they have excess inventory, they can go ahead and donate that to us, and we can get it out into the community. We are food rescuers at the utmost extent, and the only way that we are going to be able to meet the ongoing needs is with these increased donations as well as with government support.
And it really does require collaboration, partnership between the government and individuals, churches,
Yes.
et cetera.
That's right.
Crystal, you know, we are entering a new administration. How do you see what may happen with the Trump administration? Do you have the support of Congress, and how do you build that?
Well, so one thing I would say is that anti-hunger, working to end hunger in the United States is a bipartisan issue. There are very few people in the United States who think people should be going hungry. So we are really excited to work with the incoming administration and the incoming Congress to really find solutions to reduce the increase in hunger and poverty that we've been seeing over the last couple of years. There's lots of things that Congress and the new administration can do, and so we're excited to get to work.
What would you like to see happen? What is needed? What are the top priorities?
Yeah, I mean, we would love to see healthy school meals for all nationwide. We're excited about Summer EBT, which is a program that kind of started a little bit under the Trump administration as the pandemic EBT program. Not every state is using it. Texas is actually coming into it this summer, and we're hoping that all states will come in. So excited to work with them on that. SNAP benefits are not high enough for families, so excited to focus on that as well. The WIC program is really important, so we want to make sure that that continues and is fully funded. But there is a long list of things that Congress and the new administration can do to make sure that kids and families and seniors and veterans are not going hungry.
Which federal department handles the work that you do? Is that Department of Education or Health and Human Services?
Surprisingly, it is actually the U.S. Department of Agriculture that oversees the nutrition program. So, and you know, there's actually a really interesting history with SNAP and with school meals, where it is also about supporting farmers.
Now, you said that you'd like to see the SNAP benefits increased. Give us a sense of what they are now and what you think there should be.
Yeah, so it works out to be about $6 per person per day. And some people have actually done like a SNAP challenge and tried to feed themselves with a healthy diet and tested that out. And it is really hard to actually purchase a healthy diet with that level of benefits.
We see it with my apple.
That's right.
Right. Yes, that is not filling enough to get you through the day. 6 apples certainly is not. But during the pandemic, we actually had an increase in SNAP benefits. They called them emergency allotments. And that was also one of the many reasons why, and one of the many supports that families received during the pandemic that helped reduce hunger. So, they have increased benefits when they adjusted them through the 50 food plan, which is just kind of a very complicated DC term, but we would love to see benefits even higher and definitely want to maintain the level that we have.
Now, one thing you see in Texas, not in Dallas, where there seems to be a Whole Foods or Central Market on every corner, but you can drive through our good state and just see deserts where there are just no grocery stores.
Correct.
And I get, the private sector doesn't want to put a grocery store where they're not going to make a profit. So how do you address that? Because it really is an obstacle.
And I believe that's one of the many obstacles that people face. So we talked about rural hunger was much higher percentage of people that are food insecure. But you can go into urban areas and see these food deserts, and you see high food insecurity in those areas because they typically have lack of access, but they also have lack of transportation, and they have additional barriers that maybe others in the rural areas may or may not have. So those higher concentrations in food deserts, those are areas where we have more food pantries into the community, and we have to make sure that they have access to additional food. Everyone has resources, and they want to use those resources. They don't want to go to food pantries and get their food. They want to be able to go and make the choices that they need for their family to be able to go forward. And I would just like to add on for policy's sake.
And you got 10 seconds to do it.
The Farm Bill is so important. This is unacceptable. We need people in our community to stand up and tell our elected officials to
You're a
support
good
the Farm
advocate,
Bill.
and you guys have been great guests. I'm so appreciative. And, really, each of us has experienced the discomfort of skipping a meal or two. But imagine just for a minute the pain that parents and guardians confront when faced with uncertainty about their child's next meal. As we learned today, it doesn't have to be this way. In our country and here in our community, we certainly have the means to ensure that everyone has access to sufficient nutritious food for a healthy diet. It's going to take education and a willingness to reallocate resources, but considering the positive impact, the choice seems really easy. Thank you for taking time to learn about this important issue and for watching Perspectives Matter, where we talk about things that matter with people who care.